On this day 5 years ago, Maine saw its first presumptive positive case of COVID-19, and our lives changed forever. So what have we learned from that pandemic? Dr. Dora Mills, the former director of the Maine CDC and the current Chief Health Improvement Officer of the state's largest healthcare system, MaineHealth, is joining us tonight. Thanks so much for being here.
Oh, it's nice to be here. Thank you, Chris.
Dr. Mills, you and I spoke probably every week during the pandemic. When you look back over the past 5 years, what do you think the most significant lesson was that the public health community learned from the COVID pandemic?
Oh, I think for sure, particularly here in Maine, it was the fact that when we come together, we can do so much more working together. When I think about Maine, we know that we are the oldest state in the nation, and yet our older people are the people who are at the highest risk for severe disease and death from COVID. And we're also the most rural state in the nation. And yet, because people came together, hospitals, health centers, other providers, companies, education, government, we all came together. We actually had some of the lowest death rates in the country, and we had also some of the highest vaccination rates in the country. And it was really, I think, because we came together. For an example, we had at the early days, 5 years ago, we didn't have masks. We didn't have many. We had LL Beans and Flowfold making us masks. Right. We also, when we got around to the vaccines a few months later, we had mass vaccine clinics, and most of our volunteers were employees of other companies like LL Beans and Unum and banks who were redeployed for weeks and months at a time to help us staff up those vaccine clinics.
You know, the pandemic itself took such a toll on the mental health of so many people in our state. How are health organizations addressing some of those long-term mental health effects of the pandemic?
Well, we know that the mental health of the whole population, particularly youth, young kids and young adults, was deteriorating before the pandemic, and it certainly worsened a lot throughout the pandemic. So what we're grappling with now is how do we improve the mental health of the whole population. So we know, for instance, social connectivity, getting people together, getting kids and young people off their smartphones and working, talking with each other, interacting with each other, that's really important. And also we're implementing programs such as Mind Up and Sources of Strength and Mental Health First Aid, which provide people the tools of all ages to reduce stress and help others who may be having trouble.
We know that one of the big issues, right, was isolation. And then it wasn't too long ago, probably within the last year to year and a half, that it was the Surgeon General who put out that warning about isolation and how it can impact a person's longevity, how long they live.
Exactly, yeah.
And it seems like that's something that really came about because of the pandemic.
Yeah, I think we became much more aware of it. So we are working at MaineHealth, for instance, to integrate social connectivity throughout all of our programs, where we didn't do that as much before the pandemic.
Do you think that as a country, we're prepared to face another pandemic of a virus like COVID-19 that might be a little bit unknown, where the science around it is changing frequently?
Certainly we're much better prepared than we were 5 years ago in many ways. So for instance, we know we have a unified system now for addressing respiratory viruses. So if you notice, it's like the weather report now. We've got everybody used to looking, I'm hoping at least, to what's going on in your community, in the state, in the region, for not just flu and COVID, but RSV and others, because we know that unified approach helps, and it helps us to prepare for whatever else hits us. We know going back to the basics is important. Hand washing, and masking if you're at high risk and you're going to be indoors with a lot of people. And ventilation, those strategies help, and we learned a lot of that through the pandemic. We relearned it, and we know that helps with other pandemics as well. And telehealth, things like telehealth, which we didn't have much of 5 years ago, really got exponentially expanded during the pandemic. And that's helping a lot of people, particularly being a rural state. We're able to provide a lot more health care much more easily through telehealth.
Trying to address some of those disparities that came up because of the pandemic.
And we can do that with another pandemic as well, using telehealth, and all those basics work as well.
Dr. Dora Mills, thank you so much. The Chief Health Improvement Officer for MaineHealth, thank you for being with us tonight.
Thank you.